Hi, everyone. Welcome to the Future of Metabolic Health AMA with Dr. Casey. I'm Sissy Hugh, and I am the community lead here at Levels. Dr. Casey is the co-founder and chief medical officer at Levels, and she'll be hosting today's session. She will do a quick intro, and then we'll open it up to Q&A. I will drop the link in this chat, so feel free to drop in any additional questions you have, upvote your favorite questions, and then at the end of the call, we'll snap a group photo. So if you have your Series A mission patch with you and want to include it for the photo, please feel free to grab it during the call. And we'll be recording and distributing the session afterwards. I will hand it over to Casey to take it from here.
Hello, everyone. Can you hear me okay? Thumbs up. Awesome. Thank you all so much for being here. This is so thrilling to get together with you guys virtually. And I know I see a lot of familiar faces from social media and from people I've chatted with on those channels. And it's so fun to be able to put some faces to some names. So thank you so much for being here. And I can't wait to dive into some questions. I put together just a couple minutes of some general thoughts of some of the things that I'm thinking about as we think about the future of metabolic health. And so I will just lay out a few of those and then we can jump into some discussion. So I know if you're here, obviously you also care about metabolic health. And just in terms of my background, which some of you probably know, but others might not, is that I originally trained as a head and neck surgeon. That's what I did my residency in. And I was focusing on, very niche parts of the head and neck. I was doing sinusitis surgery and ear surgery and things like that. And it just became so overwhelmingly apparent to me after 4.5 years in the surgical world that just something that we were kind of ignoring in the healthcare system was this monumental burden of metabolic disease. And the numbers were just so staggering. And yet it seemed like it was no one's responsibility. There's 42 medical specialties. And it's kind of like, you just kind of ignore these issues and assume that the primary care is going to take care of it. And yet this just did not feel right because, we've got almost half of Americans now with prediabetes or type 2 diabetes. And we know that these blood sugar issues are linked to almost every leading cause of death in the United States. If you have diabetes, you have about over 2 times higher risk chance of having heart disease or having a stroke or things like this. And Alzheimer's dementia is being called type 3 diabetes because it's so related to blood sugar. And these things are so connected. And yet we see the body in healthcare is so separate. And it became apparent to me and very urgent to me that I kind of needed to break out of that subspecialized world that I was in and think about this bigger picture, this elephant in the room. If I was going to have the impact I wanted to have in healthcare and to help patients the way I wanted to help them, which was to actually get healthy, to create health in patients, as opposed to just treat these little aspects of their diseases that are downstream of kind of the bigger picture. And so, not to belabor the stats, but it's unbelievable. If you look at the CDC's list of leading causes of death in the United States, every single one, except for one, is related to dysfunctional metabolism or dysfunctional blood sugar. And the one that is not is accidents. So just like accidental deaths, that is the one that is not related, but otherwise they are all. And so we got to get on top of this. And that's why I'm just so grateful for this community of people who are passionate, who are thinking about this issue and who want to get this right in their own lives, because unfortunately the cards are stacked against us, right? It is very hard to be metabolically healthy if you're just kind of going down the normal track of American diet and lifestyle, right? We've got the food subsidies that literally directly are subsidizing the cheaper cost of disease promoting foods like corn, wheat, and sugar. We've got our grocery stores that are literally filled with ultra processed foods, over 60% of which have high fructose corn syrup or sucrose in them, which are overloading our bodies with monumental amounts of sugar that we never evolved to process. There's stats that we are eating 60 to 150 times more sugar, all of which has to be processed by ourselves than we were about 100 years ago. And it's causing problems. Of course, we have a very sedentary lifestyle. Our homes, our schools, our workplaces are now all focused on on sitting. We've got the chronic low-grade stress with the phones always dinging and the emails and the honking and everything. And then we're sleeping hours less than we were historically. And so all of this is stacking up to basically hurt our cells in a really unique way that makes it hard for us to do this fundamental process of metabolism. And so when I think about the future of metabolic health, what I'm really excited about, and actually what I'm writing a book about right now, is that we need to totally shift the way we're thinking about healthcare to this root cause approach, this more network biology approach, where we look at how diseases are connected and less about how they're separate, and move towards an energy-centric view of health and disease. And so what I mean by energy-centric is that a way of training in medicine and practicing medicine where we are super focused across every specialty at how are we optimizing the energy production pathways of the body. And this is metabolism. This is how we take fuel, so things like glucose and fat, and convert them through the mitochondria and through all these cellular processes to the currency of energy we can use in the body, which is ATP. That somewhat simple, paradigm of how do we turn fuel to energy is radically screwed up in most American bodies right now. We are fundamentally having problems with the core way that we make the energy for our cells. And that's why this is showing up as so many different conditions, because whatever cell type this is happening in, whether it's a blood vessel, or an ovary cell or a brain cell, it's going to look like different things, but is so connected by this fundamental pathway of energy production problems. And so if we can really orient around how do we optimize those, how do we get those right, how do we create health in the energy producing machinery of our body, I think we can transform our own health, the American healthcare system. But that takes a totally different way of looking at the body, of even medical training, and of how we're thought to think about our own bodies. I am at this point in my life walking around literally thinking all day, how do I support my mitochondria? How do I get more of these energy factories and get them working properly so I can convert that fuel to energy effectively and get the cellular energy that I need to power all the processes in my body that I know all aspects of our Western modern diet and lifestyle is basically hijacking. And so that's one framing that I really am trying to push forward in the world, is moving towards an energy-centric view of health and disease as one of the key network links that's linking so much of the issues we're seeing today. A second concept that I've been thinking a lot about is this idea of health and eating as really a matching problem. So we have this body of 37 trillion cells, and every one of those trillions of cells all has different needs. It needs nutrients, it needs different, it needs energy, it needs certain hormonal signals. There's all these things that each cell needs to function properly. And the crazy thing is that those are changing minute to minute based on our experiences and how things are changing. We have hundreds of millions of cells die each day and actually regenerate, right? Things are constantly in flux, and our body is this shapeshifter that's always taking in food from the environment, excreting food. We are constantly in flux and in constant communication with the external environment, just essentially dying and regenerating constantly throughout our lifetime. It's incredible, but the body has different needs really at every moment. And I think one of the reasons we're getting sick is because we can't understand those needs, and we can't understand the dynamicism of it and really know what the body needs. And we have to figure out how to match what the body needs with what we're giving it. And what we're giving it is what we're putting in our mouths, what we're exposing ourselves to, how we're sleeping, when we're moving. So for instance, one simple example of this, of like the matching problem, is like if your glucose is really high right this second, then we need to kind of match that with a way to get the glucose out of the bloodstream. So that might mean doing some air squats or taking a walk, or doing something that helps create a sink for that glucose to drive that pathway towards use as opposed to storage. That's a simple example. Another one might be that if you're quite stressed and you're making a lot of stress hormones, it can really deplete your B vitamins. And your B vitamins might happen to be more depleted, even if you're eating the same thing every day, because you're generating more stress hormones. So we need to match more input of B vitamins with the situation at hand. And so that pairing is something we haven't been able to do before. And I think glucose monitoring is really the first time we've been able to create this like one-to-one relationship between our current need and then what we can do right now. But I think the future is we're going to have a lot more visibility into that. So this is where we talk about continuous monitors for other analytes like micronutrients, vitamins, hormones, other types of metabolic biomarkers aside from glucose, like lactate or ketones or things like that. This world is coming, and I think it's going to be very exciting because, again, we're up against a lot of demands now, societally, culturally, in our food environment that make it harder to understand what our body needs, and we're breaking down because of that. Cellular dysfunction and the symptoms and diseases that arise from that, are really in large part a result of the cells not having the conditions that they need. And if we can see those conditions better through more monitoring, through other channels in these continuous monitors that we can track and understand what the body needs, we can make better decisions about what we're putting in our mouths, how we're living, how we're sleeping, how we're moving, how we're stressing, all of these things. So I'm very excited about that concept. And then the last thing I'll say is that, and I think probably a lot of people on this call, I recognize this, but it is so exciting that we have glucose monitoring. It is the only continuous biomarker we can track right now that's actually an internal biomarker. And it's also really the only continuous biomarker we can track that tells us anything about nutrition right now. It's amazing. For us to be healthy and have the longevity we want, we've got to get glucose levels under control. But it's not the only biomarker that we need to shape our diet around, right? It's one thing. And there are many, and a lot of people have probably had this experience where a continuous glucose monitor that like you might have a slice of pizza that's like, not necessarily a healthy food, but you have a flat glucose response. And it's like, wait, my glucose was fine. Does that mean this is okay? And if we had other things we could see inside the body, like for instance, inflammatory markers, oxidative stress markers, free fatty acid markers, maybe uric acid, which is a breakdown of fructose, there could be high fructose corn syrup in the tomato sauce on the pizza. If we could look at these other things, we'd have more of a complete holistic picture of what that food was doing to our body. And it would not be quite as simplistic of a view of like spike bad, no spike good. So we need to move there if we really want to understand the true picture of how food is affecting our health. Again, glucose is a huge amount of the way there. It's low-hanging fruit. And if you do spike to something, there's always something to learn from that. But the question of if I don't spike to something, what else might be going on, I think is a really exciting future. So that's, again, getting into other analytes that we might be able to measure down the road, and some exciting stuff around multi-analyte sensing. So those are just a few kind of thoughts and future directions I wanted to share with you. I think the key point that I'm just thinking about obsessively right now is that, we've got to get our mitochondria and our energy factories in the cell working better if we're going to reverse the metabolic health crisis, if we're going to reverse the chronic disease epidemic. There are so many things that go into mitochondrial function. And the 7 I talk about a lot is food, exercise, sleep, stress, micronutrients, microbiome, and environmental toxins. These are all things that can feed into mitochondrial health. And so we're going to have to fix this holistically. We're going to have to fix the mitochondria to fix the healthcare crisis. And that means that we're going to be having our metabolic processes work better. And so holistic and multifactorial is the name of the game. Having more visibility into all those different channels is going to, I think, help us make better decisions. And that's really the world that Levels is trying to help create. So sorry to talk for a little bit longer than I expected, but I would love to jump in with any questions that you guys have.
Thanks, Casey. Why don't we get started with Maris's question, which is at the top of the Slido. Maris, you want to come up and elaborate on your question? I think Casey talked a little bit around the question that you asked, but feel free to dive into more specifics.
Sure. Hi, Casey. So given the current state of the medical system, which I believe you're very familiar with, do you foresee people having to take more control of their overall health in addition to their metabolic health?
Great question. And so nice to meet you. And thank you for being here. It's interesting. So I one thing I think is that I really look at metabolic health and overall health as the same thing. Metabolic health is the foundation of all health. And by that, the sort of framework I'm thinking about is that health is a function of our cells working properly at scale. That's what health is. And disease is cells not working properly. That's all, because that's all we're made of, right? And for a cell to work, table stakes, it has to have energy. It has to have energy being produced properly, or else nothing happens in the cell. You need that fuel to ATP conversion. And so metabolic health is just foundational and kind of table stakes for overall health. I'm so sorry. There are people mowing the lawn outside, and it'll be done in just 2 seconds. Of course, the 30 minutes of every 2 weeks that this is happening, it's right now. I'm sorry about that. So that's just one kind of mental model that I think is important to kind of realize, is that metabolic health is kind of a foundation for everything else. It is necessary, but not sufficient to have perfect health, but you have to have metabolic health if you want to have optimal health. And the answer is yes. I do think people are going to have to take ownership of metabolic health, overall health for themselves in a lot of ways, and actually really change the way they kind of view their relationship with their doctor. The incentives of the healthcare system are really challenging right now, right? Because doctors essentially get paid for volume. They get paid for seeing as many people as possible and for doing as much as possible. So as a doctor, if you see 40 patients a day, like that is the best option for you in terms of your bottom line. There is a movement towards what's called value-based care, which is actually where you get different reimbursement for higher value, which is better outcomes, but we're still in very much a fee-for-service type of system. Unfortunately, what this does is it promotes volume. And so the time to spend with a patient to really dig into the nuances of what's going on is lacking. And I'm sure many people have had this experience with, if they have been going to a regular doctor, not sort of, more a boutique practice, where they essentially are seeing the doctor for like 10, 15 minutes. And this is maybe once or twice a year. And that's just not enough to dig into the complexities and the nuances of this stuff. And so I think we really have to, and the other piece of it is that we are trained as doctors in this system to really focus on more of a, hold on 1 second. I'm just going to see if I can get this sound. They're walking by really fast. I hope it's not too loud on your guys' end.
You're good, Casey. For me, I can't hear it on my end. Not sure if other
Yeah,
folks
we can't hear it, Casey. You're good.
You're fine.
Okay, there's literally someone blowing right outside my window, the blower. Okay, good. I'm so sorry. So to create health in the body, to actually create true health, it requires the dietary and lifestyle factors, consistently that are personalized to what our body needs. And that's not the plane on which the doctor is operating, right? That's not even how we're trained to think. We are there to, if there's a big issue, to identify it and sort of mitigate the sort of downstream, results of that issue. Things like heart attack, stroke, et cetera. We're really good at those acute things, but the chronic stuff, which is fundamentally based in diet and lifestyle, there's not an instant that takes longer to dig into. It takes longer to coach about. It takes longer to focus on really what the root cause factors are. And that's just not how the system's set up. So I think it really is in the best interest of the patient to be on top of that and to really look at the relationship with the doctor as more of like a coach who can kind of help them with some of the high level, big picture stuff and a lot of the acute stuff. But for the chronic diseases that we're trying to avoid, I think we want to have a world in which people are very knowledgeable and empowered to understand how their bodies work and how to make them work optimally. Like we need to sort of have the owner's manual for our bodies and be thinking about the day in and day out stuff that we have to do to create health, and look at our doctors more as, at least in the system now, they're there to help us with, acute, severe issues that we can't really handle on our own. But day to day, like we have to take ownership over moving in the right direction towards creation of health. And I think we totally can. And I think the system, unfortunately, has somewhat discouraged us from feeling confident in that. It's almost been this sort of infantilizing system where it's like, we have a very difficult time accessing our health records. It's a huge burden to even like transfer records amongst doctors. We are often just given a sheet of paper with lab results and sort of like no explanation, like we can't understand it. And I think the thing that I love, especially about our levels advisors, is that they've made it really understandable for people. Like we can all figure this out. And a lot of the people I know in the metabolic health space, and a lot of even our levels members, know more about metabolic health than a lot of doctors at this point. And so just to feel really empowered of like, I can understand my body, I can make the right decisions for me. And I need to, if I want to have an optimal health trajectory. Because even if there were a doctor out there who were perfectly trained in nutrition and perfectly trained in health promotion, they can't be on your shoulder 24 hours a day. They can't be there every second to say, eat this, don't eat that, all that. That's our responsibility. And so, yeah, I really would like to see the creation of health ownership being something that we all take on as something that really is our responsibility and our primary responsibility in life. It's foundational for everything else. And hopefully, I think that grassroots movement will also nudge doctors to care about it more, because we're going to educate our doctors about how we've gotten healthy. And that type of experience can really inspire people.
Great. Thanks, Casey. Nicholas had a good question in the Slido, which Nicholas, I'll invite you to jump up if you would like to ask your question.
Yeah, sure. No, thanks. And thanks, Casey. No, actually, on that note, related to my question, so my camera isn't working, so otherwise I would come on. But my question was, do you see the Western medical practice, right, and the generic doctors starting to follow more of a functional medicine type of practice? I mean, I know, so I'm based in Boston, right, and I know the medical field here is pretty good, better than some other places around the country. And I've suffered, a number of health ailments and gone to a number of doctors, things like that. And I know they've started doing over the past number of years their own clinical trials to look at certain, factors that are related to functional medicine approaches, right? Do you see that expanding, and kind of what's your thoughts on that, and what's the timeline regarding like the Western medical field?
Yeah. Well, first of all, great to meet you, and thanks for being here. I am super heartened by some of the trends I'm seeing in the medical field. Again, going back to even people like the level advisors, Mark Hyman, Sarah Gottfried, David Perlmutter, Gerald Schulman, Ben Bickman, there are people out there thinking and talking loudly about these topics of more health creation and functional medicine, holistic medicine, food as medicine, whatever you want to call it. And if you go on Amazon and look at the top selling books in health, it's all these books, right? It's not, how to take medicine, lots of medicines for your chronic diseases. It's how to eat and live to be as healthy as possible. You've got people like Huberman Lab, right? Like Andrew Huberman, with millions and millions of people watching these YouTube videos and these podcasts, which are deep dives into the science of what we can do to optimize our health. I mean, these are trends that are, to me, so exciting. And I think not stuff we would have seen 15 years ago. So it's the scale of this movement is thrilling to me. And I think we are on a path that's going to be hard to reverse. There are still doctors that I talk to, like even in my close network, who would, if someone would come with a GI issue, and they might say food has nothing to do with this, or that people with diabetes, type 2 diabetes, don't necessarily need to reduce their sugar intake, but need to make sure that their insulin is dosed appropriately so that they don't, so that they actually manage the glucose they're taking in. So essentially there's still a prevailing narrative that food has almost nothing to do with health. So that's a little frustrating still, but the trends I'm seeing are very, very hopeful. And you've got, of course, trends in digital medicine that are happening where, and I think COVID accelerated this, where there's this real comfort with sort of this more digital health ecosystem, which means that the patient is often, on their own, at home, kind of, more in charge of the tech stack of their health. And I think that's a positive trend as well. And then you've got this whole world of wearables like Whoop and Fitbit and all these things that, again, 15, 20 years ago, these didn't exist. And now they're actually being covered by insurance, like Fitbit is literally part of a lot of plans at this point. And so I think there's amazing trends happening, and I'm really hopeful. I think one of the biggest challenges that I don't fully understand how we're going to fix this is the research piece of things, because the way research is done with the double-blind, placebo-controlled, randomized trial really lends itself to very specific, very controlled micro interventions, like a pill, like a 100 milligram pill of XYZ. See if it works compared to someone who's not taking it or taking a placebo. Those are the easiest trials to do. And it's super complicated and hard. And there's a lot of variables involved in research that's more holistic or food-based. And I don't think that's a nut that we've cracked yet. I think that wearables in research are going to be a very exciting thing, because we're going to start to see the personalized variation to responses and start to realize that we've got to treat people on a more individual level and not just as an average as a result of these types of studies. Drugs can get approved just because they sort of help the median of this bell curve, but there's a lot of people not in that middle section. And so I think wearables are going to help really bring that to the surface. But, but ultimately we need to get to a world where like food prescriptions are a thing, and stress management prescriptions are a thing. And nature, in Japan, some doctors prescribe nature pills because there's actually so much research showing that 15 minutes in a green space can lower stress hormones and other metabolic biomarkers, that they actually prescribe it. But we need to do that research for it to be reimbursed and covered. And so it's going to take a lot of creative people to think about how to make that happen within the system that we're living in. So showing cost efficacy, showing, real results. So that's one area I think of blue ocean stuff that we need to and Levels is certainly trying to help with this, but I think more wearables in studies is going to be a positive thing. And it also just gives you so much more information. Like imagine doing a study on a diabetes intervention where people aren't wearing continuous glucose monitors. These days, I think that would seem almost crazy, right? And there's not a lot of studies where people are wearing CGMs, but I think we're kind of getting there, and it'll really help show that biochemical individuality. And then of course there's this movement towards N of 1 trials, which is where basically like you give a bunch of people interventions and they're all being essentially continuously biomonitored, and you try and figure out essentially a therapy for the individual. So if you had a cancer medication, for instance, and you were able to track a lot of these cancer biomarkers in real time or regularly, you could know very quickly, like, is this medication working for this person or not? And not just sort of lump them in with the average. That is still controversial. But that's just N of 1 is a term you might be hearing more about. But I think how we can integrate our gold standard types of medical research, which is double-blind, placebo-controlled trial, with these more holistic interventions is where we need to figure out and do a lot more creativity. Okay.
Right, makes sense. No, thank you for that, Casey. Appreciate it.
Okay, I think I'm next. Hi, Casey. I'm Celia. I am a friend of Molly Maloof. That's how I came to Levels and joined your beta. So thank you. I, like a lot of people, was diagnosed with prediabetes, and I was like, "Are you kidding me? I'm not overweight. I exercise." And she was the only doctor who said, "Throw on a CGM," and this because she's been wearing one for years. And so I ended up resolving it, going from a 5.7 to a 5.4 in 4 months with Levels. But I was completely on my own. Like, I happen to run marketing for health and wellness brands. So I'm like that person who had the time and the expertise to kind of do that deep dive onto, like, listen to all the podcasts, follow all the functional medicine doctors, like listen to all of your podcasts. And I went back to my doctor armed with my CGM data, my Aura Ring, like pages of notes. So I'm either your worst nightmare or your patient, right? But I was really kind of on my own, but I am the kind of person that had the time to be able to do that. And so my question to you really is, like, what do you see the role of the health coach And do you see like health coaches kind of becoming part of like medical practices? Because obviously, like you said, like your health doesn't start in the doctor's office. I saw my doctor for half an hour. I had to beg her for a fasting insulin. But I did it on my own, but I could certainly have used it. And the doctor probably could have been like, okay, this is what's going on. Here's your health coach. So I'm curious to see how you see that kind of support system bridging the gap of healthcare.
Yes. Well, first of all, so amazing. You are incredible. And that is so inspiring, and congratulations. And I'm so happy all that happens with Molly and Levels. And I'm just so impressed. And that inspires me so much. And so I think that one of the things I'm really excited about with health coaches is that even the existence and like emergence of the trend of health coaching is such a great signal, reinforcing this idea that what you said, like health doesn't happen in the doctor's office, right? There's this like kind of fallacy that like we go to the doctor to get healthy. That's not what happens there. First of all, you don't get healthy in a 20-minute visit. And unfortunately, a lot of the things we talk to about the doctor are not things that actually promote health creation. They promote usually reacting to something that is already developed. And so coaches, like what they're there to help the patient in their daily life figure out how to overcome the barriers and create the strategies to promote health creation. So that's an amazing trend. And I think I can see it really working very nicely with sort of the wearable movement, especially as we get more continuous biomonitors. And just to share a little bit more about kind of what's happening in the continuous biomonitoring space. So like right now we just have glucose, but you may have heard that like Abbott has just announced at CES, a big tech conference, that they're actually going to be putting out 3 new sensors. So ketones, lactate, and alcohol. And so we're already starting to move in. I mean, I think that's just the tip of the iceberg of seeing what it's going to look like to have more continuous biomarkers. And so these are going to be the things that are giving individuals the continuous biofeedback for themselves. Like they get to be the owners of that data, which I think is really important. Like even if you have a health coach, to know that you are the one receiving the information about your own body and know how to interpret it yourself and know what to do with it. I think that's actually a really important unlock just psychologically. Like this is my data and I know how to interpret it and I know what to do with it. We've got to get there, for everyone. But a health coach can, I think, really help with the interpretation and all of those things, but also all the barriers to then doing something with that information, because it's hard, no matter how great your app is. And we're trying to make, of course, Levels into something that really helps people eventually like understand a lot of the more like psychosocial elements of why it's hard to make consistently healthy decisions and help move them through that journey. But having that one-to-one relationship with a person can be really useful in taking that information and actually applying it consistently in your life and knowing what the barriers are to making the consistent decisions. And since consistent decisions are the name of the game in reversing this healthcare crisis, there's a huge opportunity there. But I think it's a different role than the continuous biomonitors that can be really, really synergistic. And then ideally, I'd love to see a world in which doctors really understand these data streams and, kind of the highest level insights that the health coach and the patient put together for them kind of bubble up to them, and they can kind of give a big picture about how this fits into the larger health trajectory potentially, but they're not ever going to be the people doing the day-to-day coaching just because they're not trained and they don't have the time. And I think that's where having coaching can just be really a huge accelerator of progress. So I think the patient still needs to really be the owner of that data, but the coach can really help them understand the barriers to making the consistent lifestyle decisions, and also help them understand all the options they have for, if your glucose is high, for instance, there's like a lot of different things you can do, right, to help get your glucose down. You can not eat that food. You can pair the food differently. You can time the food sequencing differently. You can exercise after the meal. You can do apple cider vinegar before the meal. You can, you can get more sleep. You can try a different exercise regimen. It's hard for a person to know exactly what's going to work for them. And I think where they're going to be most motivated to actually, which levers to pull at that moment in their life to have the biggest impact. And I think a coach can really help kind of prioritize and help weigh those decisions, which is really important in the whole glucose metabolic health realm, because there are so many avenues towards improving, mitochondrial function, but some might work for me and some might work for you. And this could be very different in terms of what we're going to adopt consistently in our own lives.
Well, thank you so much to you and Levels for all the information you guys are putting out for everyone, because it's so helpful. I mean, the fact that I could get this far by myself without a coach and kind of half a doctor, it has been really powerful. So thank you.
Oh my God, so cool. Thanks so much, Celia.
Hi, Casey. Bobby Downs here.
So good to meet you. We interact a lot on social media, so I'm so happy to see your face.
So great. So grateful for you. Was introduced to your voice the first time on Clubhouse in March of 2021. And so I'm grateful for the voice that you have in the world today and for your part in moving humanity forward. It is truly inspired work that you're doing. And I can hear it in your voice, your passion. So we're, on behalf of everybody, we're just so grateful for helping us become empowered. And that's really important. I recently shared with you that my mom, who was 79, passed away. And I've become, over the last couple of years, her and my dad's caregivers, because they both have type 2 and type 3 diabetes. And as a part of my own health journey, obviously recognizing the genetics can play some part, but really I'm the one that's empowered in taking control of my destiny, my journey in this. So my parents have become my de facto inspiration by the fact that they haven't chosen all of those many micro decisions they've made throughout their life. And so I've learned from them. But when my mom passed, I talked to her attending physician about what the cause of death would be, knowing full well that she died of metabolic dysfunction. And they said, we cannot put her cause of death as metabolic dysfunction. It is not ever a primary cause of death. And so my question for you today is, how does that change in a world that doesn't even see metabolic dysfunction as the primary cause of death?
Oh God, such a good question, Bobby. And also, thank you. I am so grateful for you and the energy, the amazing energy you put into this whole field and topic. And it honestly just brings a tear to my eye, because interacting with people like you and really just everyone who's on this call, it's that's the answer to your question. I think it's we learn, we figure this out together, we educate, we listen, we talk, we share it with our friends. This is it right here, I think, is the answer to your question. I feel it, and we're all going to go out and have conversations about this with our friends and with our family. It's going to impact how we cook. It's going to hopefully impact how we talk to our doctors. And that is, I see that how this is going to go, and this is, part of why we do so many podcasts at Levels, and, why we do our whole content operation. And, one of our first 10 hires at Levels was an editorial director, because it's we knew that there are foundational things that just are not, we don't really understand in the modern medical system, that are clear in the science, but we're not practicing that way yet. And we have to be part of that education. And one of our core beliefs is that we think this is going to happen from the bottom up, not the top down. The incentives are so entrenched at the top. The biggest industries in our country, right, are food, agriculture, and healthcare. These are huge multi-trillion-dollar industries, but people want to be healthy. People want to make better decisions, and help their families and live a vibrant life. And so that's how we've approached this. And education has been a core part of how we're doing that, because we really do believe that that's going to have a trickle up effect, to really change the system. I think that, and there's lots of ways to approach it. Of course, there's policy, there's teaching, and we're thinking about all those things too. But really our primary focus is people understanding more about their bodies and then having these types of conversations. And your story resonates with me so much. I am also driven by my family in terms of being inspiration. My mother passed away last year from metabolic disease, and there were about 100 steps in her life that people could have spoken up and given her clues of what was happening that just didn't happen. And one of the things that, just kills me is that, like, when I was born, I was 11 pounds, 9 ounces. And, my mom was not diagnosed with gestational diabetes. So I was what's called a large, high gestational weight baby, essentially. Like, really above like 8 or 9 pounds, you start to be worried that like something that's not quite right. But we kind of celebrate big babies in this country. And I was always celebrated as like, oh my God, you were one of the biggest babies born at this hospital, Sibley Hospital in DC. But what the research shows super clearly is that babies and mothers who have large for gestational age babies, or I'm getting the term wrong, but high gestational weight babies, and the babies who are born that large, like, very much higher rates of metabolic disease down the road, in part because insulin drives, this growth, right? And so it was probably very likely that my mom was quite insulin resistant during her pregnancy, but it just didn't show up on the gestational diabetes test. So if someone had said to her then at 35, you had this huge baby, this is something we should probably think about doing more deep testing on what's going on with you metabolically. Then she had a really hard time losing the baby weight, which of course could have been another sign that there was some insulin resistance going on. And then later developed prediabetes. And then all these things just like unfolded, like hypertension, this and that. And she was always trying to be healthy, but, of course, doing what everyone recommended, which was the low fat, high carb diet. It was the 90s, et cetera. So really trying hard, but within a tough system. And I just look back at that. And then ultimately she developed pancreatic cancer and died. And pancreatic cancer, one of the biggest risk factors is insulin resistance and diabetes. And so you look back at this life, and even back to childhood, like she was born in the 50s, it was all about formula, wasn't breastfed, this, that changes the microbiome, which sets you up for, like, it impacts the microbiome, which can, impact metabolic stuff later in life. It's like, you look at the life and it's like, hindsight's 2020, like so many places where we could have thought through a metabolic lens and potentially had a different outcome, but nothing. Nothing. And of course, everything just seems random and different if you're looking at it, the conventional system, but in fact, it's all integrated, and so that drives me just so much. Like, how can we get people walking around understanding all these little things that are happening and putting them together in this systems and network biology approach? Like, we just, that is really what drives me. And, not just kind of waiting for crumbs of information from up high about what's going on inside our temple, our body. And so, so I really hear you. I think family situations probably drive a lot of people's passion for this, wanting to help family and have better outcomes. And I think that that's a really strong motivator. And I really relate to you on that one. But to end on a happier note, I think we are living in the most exciting time in human history, literally ever, because this is the first time ever that we have this power to understand our bodies, like, radically, day in and day out, to understand the incredible relationship between food and our choices and what's happening in our body in real time, and create a plan for our life that generates optimal thriving. And it's so exciting, and it's possible for all of us. And the body is so resilient and so adaptive. And no matter where we are on the spectrum of metabolic health or metabolic dysfunction, the body always has the capacity, with better conditions, to right the ship. And so that's thrilling. We now know this, but we just need to keep having these conversations, keep sharing it with people, and keep metabolic health at the forefront. And I think we're going to see a lot of progress for the next 5-10 years. So.